Regenerative medicine is a field of molecular biology that uses the growth of cells and tissues that can help repair damaged parts of the body. One of the reasons regenerative medicine is so effective is that it helps the body repair what is not working or functioning correctly. There are a few different types of treatment methods that doctors can use to help patients with disease or injury. Reactive care is where treatments patients receive are to respond to the effects or to the symptoms that the patient is experiencing because of a disease or injury. Reactive care usually means prescribing medications. Prescription or over-the-counter medications like painkillers, muscle relaxers, and anti-inflammatories may temporarily reduce pain and inflammation. These types of treatments can only help give the patient some temporary relief. The problem with this method is that the pain you have is an indication that there is a problem. You have something strained, torn, ruptured, not functioning properly, or broken. If you take medication, whether over-the-counter or prescribed, and it does what it's designed to do and lowers your pain, reduces the inflammation, or relaxes the muscles, you will feel better temporarily. The problem is, feeling better means you will end up using that body part more. Remember that there is something wrong with it. That's why you're in pain. If a part of your body is not working right and you continue to use it, then there is a good chance that you could cause further damage or injury. Sometimes after months or years, the damage could become so bad that it may not be able to be repaired. The other treatment method is to help fix whatever is not right inside your body, causing the problem. This method is called corrective care. If you handle what is causing the pain, in many cases can have a more permanent effect on your well-being. Stem cells are also considered regenerative medicine and a form of corrective care. Stem cells are neutral cells that can make more cells just like them, or can make other types of cells that your body might need to repair or fix an injury or a disease. So if you are having problems in your knee because over time it is degenerated and does not have enough cartilage, then stem cells can help your own body produce more cartilage. If, for example, you have an autoimmune disease and it is attacking the body it is supposed to protect, then treatment of stem cells can work with your immune system to stop causing damage. If the immune system stops causing damage, then the autoimmunity stops. There are several different types of stem cells. Doctors and scientists used stem cells from fetuses or embryos when stem cell research began. Not only did these cells bring up moral or ethical issues, they were also not ideal for fixing problems that patients had. With fetal or embryonic stem cells, the problem was these cells can grow and produce every type of tissue in the body. Because of this, they could sometimes grow things that were not wanted, like tumors or teratomas. The other issue with these stem cells is that the immune system would look at them like they were an invading force. The immune system would then attack and try to kill the administered cells. Because of this, doctors would have to give patients medications to lower their immune response. With the immune system lowered, the immune system can't respond and reject the treatment. Lowering a patient's immune response can leave them vulnerable and make it so that the immune system cannot protect the patient's body. After decades of studies, trials, and treatments in the regenerative medicine field, there is now another type of stem cell now used for treating conditions that you or a loved one may have. These cells do not have the adverse effects we just talked about. We get these cells from something called Wharton's jelly. Wharton's jelly is a gelatinous substance that wraps around the umbilical cord to protect it. The tissues and cells from Wharton's jelly contain mesenchymal stem cells, also called MSCs. MSCs are the type of stem cells we use. MSCs are multipotent stem cells. Multipotent means they can differentiate or make only a few types of cells or tissues. Since they can only become or help make a few different types of tissues, they are safer than other types of cells. Research and studies have shown that MSCs are ideal for procedures ranging from sports injuries, orthopedic conditions, autoimmune diseases, cardiac issues, COPD, kidney disease, sexual health, anti-aging, and many more. MSCs are classified as non-tumorigenic. Non-tumorigenic means they do not enhance existing tumors or form new tumors. MSCs found in perinatal tissue are also immunoprivileged, meaning they do not elicit an immune response. Since MSCs do not trigger an immune response and are tolerated by the immune system, they can continue working with the other components, enhancing the body's natural ability to heal itself. There are many functions that these cells perform. Four of the most important are they control inflammation, modulate the immune system, stimulate regeneration, and reduce scarring. 1. Inflammation is not our friend. Inflammation causes things like pain, arthritis, and some forms of cancer. Inflammation causes some of the most significant health conditions of the modern age. MSCs can also go to inflamed areas in your body and help reduce inflammation. 2. MSCs can also help modulate your immune system. If your immune system is low, you become susceptible to colds, cases of flu, viruses, bacteria, and even cancer. Sometimes there can be cancer or cancer-like cells in our body that do not become serious because our immune system eliminates them. It is essential that our immune system can be strong and active to help protect the body. Sometimes our immune system does not function properly in other ways and can attack our own body. In this type of immune dysfunction is where people get autoimmune diseases. Because of this, it is important to make sure you do what you can to keep your immune system healthy. Studies and research show that MSCs can help your immune system function better. 3. MSCs also help in the process of breaking down scar tissue. Our bodies will try to fix the problem when we have an injury. Sometimes scar tissue is formed and can inhibit total healing or function. These cells may help lessen, reduce, eliminate, or prevent scar tissue. 4. Maybe the most crucial thing that MSCs do is help with generation and regeneration. Stem cells help generate and grow your body when you are young. They also regenerate and replace cells as they die. Stem cells and stem cell-like cells help us build our bodies and fix our bodies every time we have a cut, a scrape, a bruise, or a more severe injury like a major accident or surgery. They also maintain our body by resupplying it with cells as they naturally die and must be replaced. When we are born, we have the highest concentration of MSCs to other types of cells in our body. As we age, the percentage of MSCs in other cells decreases. Research has shown that by the time we reach 50, we may have 40 times fewer MSCs in concentration than other types of cells in our body. If MSCs are part of what helps our body heal itself, and we have 40 times fewer cells when we are 50 compared to when we are born, we have 40 times less potential to health, fix, repair ourselves, or even maintain life. When we are 80, it can be low as 1 MSC to every 2 million cells. That means that the body is 200 times less able to regenerate, repair, or even maintain life. An excellent way to look at it is when we are born, we receive a regenerative inheritance account of these cells. This is when our account has the highest balance. Right away, we start to withdraw or use up our balance. We need these cells to heal, repair, and regenerate things when we get injured. We also need those cells to just maintain our bodies. As we continue to age and use up these resources, it becomes harder and harder for our bodies to fix injuries, repair themselves, and maintain themselves. As we age and our bodies slow down, so do our stem cells. For example, it takes longer for one cell to become 2 or divide and multiply. As a fetus, it takes around 20 to 24 hours for a cell to become another. Approximately at 60 to 65 years old, the doubling time, or amount of time it takes for one cell to become 2 cells, is every 60 hours. A fetal cell that has a doubling time of 20 to 24 hours can give rise to 1 billion cells in 31 days. A cell with a doubling time of 60 hours when someone is around 65 becomes only a few hundred to a few thousand cells in 31 days. This may very well be why the aging process accelerates as we age. If we look at a 90-year lifespan and break it into 3 parts, here's how it could look. You would not see a lot of aging in the first 1/3 or 30 years. In the next 30 years, from age 31 to 60, we start to see aging. Hair turning gray or falling out, wrinkles begin to show, and your body starts slowing down and cannot heal as fast or do as much as you used to do. From the ages of 61 to 90, this accelerates even more. you can see the parallel between the decrease in the number of cells we have, how fast they can reproduce, and how many different building blocks of the body they can produce. Our bodies cannot meet the demands as we deplete this regenerative account. We do not have enough in our account, and we lose the ability to heal, repair, and regenerate. This is because of the natural aging process and the various changes in the body over time. One of the hallmarks of aging is stem cell exhaustion, which can have a significant impact on our health and well-being. Remember, stem cells are essential for regenerating tissues and organs in the body. They have the unique ability to differentiate into different cell types, making them incredibly valuable in maintaining our health and vitality. However, as we age, the number and quality of stem cells in our body begin to decline. This is due to a process known as stem cell exhaustion. Stem cell exhaustion occurs when stem cells reach the end of their lifespan, slow down, and can no longer divide and regenerate. This can lead to various issues, including decreased tissue repair and regeneration, increased susceptibility to disease and injury, and a decline in overall health and well-being. Certain lifestyle factors, such as smoking, poor diet, and lack of exercise, can accelerate stem cell exhaustion. By maintaining a healthy lifestyle, patients can help slow the aging process and preserve their stem cell function for longer. As we deplete our regenerative account and stem cell exhaustion begins, our body cannot keep up with the demands put on it. We do not have enough in our account, and we lose the ability to maintain life and heal, repair, and regenerate when we have an injury. We need young, vibrant, healthy cells to help the body grow, fix, replace, and regenerate, like the cells we had when we were newborns. These newborn-like cells are healthy, robust cells that can make a difference in helping a patient's body to heal. If you were to go to the emergency room bleeding with not enough blood to live, the doctors and staff there would give you a blood transfusion. If you were to go to an urgent care center and your oxygen saturation was low, they would give you oxygen. If you went to your doctor and had blood work done and the blood work showed something was not in a normal range, they would tell you to take something to bring it back to a normal range. When something is low, many times the best way to fix it is to add more of it. The same is true with stem cells. If stem cells help us grow, fix, and maintain our bodies, then getting more of them may help your body regenerate, repair, and recover. In our office, we help patients by using regenerative medicine. We evaluate our patients and determine where and how many stem cells they need to make the therapeutic changes they hope for.